Hi everyone, I guess we'll get started. Thanks for joining us for this webinar on using frameworks in public health ethics presented by the National Collaborating Center for Healthy Public Policy. This work has been put together by Olivier Belfleur, my colleague, and by me, Michael Keeling, and we'll be presenting today. We're sharing that. Also with us in the room today are two of our colleagues, Alizé Rico and Marianne Jacques. They're going to help us with all matters technical. So if you should encounter any troubles with the sound or with setting up your computer or something, if something goes wrong, please send them a note in the chat box or by email. With that, I will close the webcam, just it takes up a lot of bandwidth, and we'll get started. First of all, if anybody's having trouble with the sound or if we're speaking too softly, do let us know. If you're connected and the sound is not very good, maybe you'll try disconnecting and then reconnecting to the teleconference line. And the numbers to call are on the slide or in the email that we sent earlier. During this webinar, we will call upon you on several occasions for your participation. And we do have a lot of people on the line today, so we can't open up the phone line, but we do want you to use the chat box to write in your comments and questions. It's quite likely that we won't have time to respond to every question and comment that is made during this webinar, and we will make some time for responding along the way. But should this happen, we may take some comments or questions from the chat and publish them later on our website, along with responses that we've had a little time to develop. There was a lot of interaction in the chat during last week's French language webinar, and if that happens today, as we hope it will, we will certainly be able to review all of the chat discussion in the recorded version. Also, if you do look at the recorded version that we'll put online later, you'll see that you can scroll up and down, and it's very easy to consult all the chat later on. We do want to point out that the PowerPoints that we're using today, as well as the recorded version of this webinar, will be put up on our website, and that means that any chat you type into the chat box, that will become visible to the public. So please bear that in mind. The NCCHPP is part of a network of 6 national collaborating centers across the country, financed by the Public Health Agency of Canada. Our mandate is to support public health actors in their efforts to promote healthy public policies. By healthy public policies, we mean policies that come from sectors other than health and which affect the health of populations. We have no conflicts of interest to declare. Now we're going to start out with a little quiz, or a little poll, just to get things rolling. When you registered for this webinar, we asked a few questions just to help us prepare our material for today. We're going to repeat one of those questions just so that we can all see together where everybody considers him or herself to be in terms of knowledge of public health ethics. So we will ask you to vote now on what is your level of knowledge. How do you see it? A lot of intermediate. Okay, about 70-30. Some of you may be experts and be very modest or not know it. Who knows? In any case, we want to repeat that we really encourage everyone to feel free to post questions and comments at any time and to respond to the questions we ask or even to answer the questions we ask according to where you're at. And we do invite people to challenge what we're saying because we can only learn from that. So we want to hear what people think. Okay, we'll move on then. Our objectives today are relatively simple, even as this webinar, as you will see, is fairly full and perhaps challenging. We would like to introduce some of the main characteristics of public health ethics frameworks. We would like to briefly present 2 of those frameworks, and we would like to apply each of those to a case. The idea today is to demystify frameworks and what they do, and to highlight some of the main differences between the frameworks that are available. We want to do this while actually using a couple of them, however briefly, on practical cases. And we hope that the practical aspect of this will help to make them more concrete. It's not our goal today to resolve the cases that we have developed and that we'll present in a moment, but rather to show the frameworks in action and to get a feel for what they look like when they're in use.
Okay, let's start with the problem. As you all know, urban heat islands are associated with an increase in morbidity and mortality rates, especially during heat waves. A map of those heat islands in Montreal showed that there can be a sharp difference between their presence in low-income and high-income neighborhoods. This kind of difference is not specific to Montreal. The map could be a representation of many cities across the country. So one response to this problem, among many possible, will serve as our first case. Imagine for a moment that your health unit has been asked to review the municipality's heat alert and response plan. One of the plan's key elements is the provision of neighborhood cooling centers during heat waves. However, some neighborhoods, particularly low-income areas where the need is the greatest, are thought to lack suitable facilities for cooling centers. One option is to bus at-risk individuals to air-conditioned shopping malls, community centers, sport facilities, etc. in other neighborhoods. At first glance, would you be in favor of busing at-risk individuals to cooling stations in other neighborhoods? We'll ask you again to vote now. Okay, it's interesting to see that most people, well, it's actually a split between no and maybe not sure. Interesting. We'll see later on if your opinion is still the same or if it changes. Today, what we're interested in is not so much what you would do in such a situation, but why you would do it. So there are many different ways of asking, should we do this? We could ask, for example, is this an effective way to improve health? And we would be looking at scientific and other kind of evidence. We could ask, is this cost effective? And we would be looking at economic analysis. We could also ask, who judges this to be a problem and who is the most affected by this? And it would be a kind of problematization or policy question that would call for policy analysis. We could also ask, is there support for such an initiative? And we would be looking at acceptability. We could also ask, how will individuals and groups be affected by this? Are some groups more affected than others? Were they consulted? And we will be looking more explicitly at ethical values. But one important thing to realize is that all of them have ethical implication. And we'll see how some of the frameworks that we're going to use actually bring those up into the ethical reflection. So this brings us to answer very briefly the question, what is public health ethics? Our interpretation of public health ethics is that it is mostly about what should and shouldn't be done collectively to promote and protect the health of communities. Three words here are especially important. Should, because we are talking about a normative practice, collectively, because public health is a collective effort, and communities, because public health action often takes place at the population level. It is also important to realize that public health practice is sufficiently different from clinical practice to require its own ethics in order to help us see ethical issues, deliberate about options, make decisions, and justify them. So what can we use to help us think about ethical issues in public health? Well, there are many options. Some may say nothing, meaning perhaps that we can only rely on our moral intuitions. Others may rely on codes of ethics of specific profession for guidance, or on ethical theories, principles, or values. Some may rely on similar cases, to shed light on potential ethical issues and ways to deal with them. Today we'll talk about ethical frameworks. They often refer to principles and values and make use of cases and intuitions. Using frameworks is probably the most common approach in public health. They can help highlight ethical values and issues, and they can also help with deliberation and decision-making. Before we go on exploring some of the characteristics of framework, let's plunge right in and use a framework that has been very influential.
So we will start with an ethics framework for public health, which was proposed by Nancy Cass in 2001. The framework poses 6 questions to be addressed in order. To introduce Cass's framework, Olivia and I will present the questions, and in a very summary fashion, we will sketch out the beginnings of responses, just to give you an idea of how the framework functions. Then we'll take some time to review some of the main features of frameworks. After that, we will work together more interactively when we apply another framework to another case. And during that second case, we will open up some sections for the whole group's contributions and perhaps for some back and forth deliberation using the chat box. The first question in Cass's framework is, what are the public health goals of the proposed program? Cass indicates here that we are looking for the ultimate health effects and not the intermediate ones, like being better informed that could lead to behavior change, for example. For the ultimate health effects, Cass is thinking above all of improved health. So for this case, not to put too fine a point on it, the ultimate effect sought would be to reduce the morbidity and mortality caused by heat waves. Next, we are asked how effective is the program in achieving its stated goals. And Cass indicates that the greater the burdens posed by a program, and these could be burdens to liberty, to costs, or to whatever, then the stronger the evidence should be. So, to respond to this question, it might be useful to construct a logic model in order to show the chain of intended effects of this intervention. Now, we're just going to step back for a moment because we should be really clear here about what we mean by a logic model and what we're doing. Within the context of the question, Cass suggests that we should look at, quote, the assumptions that lead us to believe the program will achieve their stated goals, and then to examine what those assumptions are and what data exists to substantiate each of those, unquote. So, given that, our approach to doing what's required of us here is to sketch out a rough guide that makes those assumptions explicit, and we would do that in the form of a logic model. This is something that we found helpful when using other frameworks when it comes to getting a clearer sense of what the program is supposed to be doing. And that said, it doesn't mean that we think it's best to apply some kind of a flowchart or an algorithm in order to do ethics. But this is a simple device within our overall discussion that can help us with one part of our thinking. So with that little aside in place, I'll get back to effectiveness. Our quick scan of the literature indicated that cool environments work very well at reducing mortality and morbidity, but we also learned that this is not a case of if you build it, they will come. And that is to say, it's not good enough to simply provide a cooling center or to provide transport to take at-risk persons to a cooling center. And why? Well, among other reasons, because, again, based on what we've read, the most vulnerable tend not to want to leave their neighborhoods, particularly during a time of crisis. Many people do not identify themselves as being at risk. Also, people with mental illness are particularly at risk. So, it's one thing to have a cooling center, but then there are obviously other issues at work. So, providing a bus may not just be enough. And now the rest of the logic model allows us to see in a very simplified form the thinking that would underlie such a program. For it to be effective as an intervention, one would have to identify and contact the individuals judged to be at risk, and then to convince them to take the bus to the cooling center in another neighborhood. The effectiveness of this intervention really depends upon the effectiveness of each step along the way. Now, we don't have all the information we need to respond properly to whether this intervention would be effective. But the more we look at it, the more we can see that it is a fairly complex situation that we're getting into now. For our purposes here, let's just presume that it works at least somewhat. Because if it didn't work at all, or if we somehow determined that it wouldn't work at all, then according to Cass, we could stop our ethical analysis right here. Because there's no point studying further something that has already been shown to not work.
Then we are asked, what are the known or potential burdens of the program? And Cass asks us to consider 4 kinds of risks. Risks to privacy and confidentiality, liberty and self-determination, to justice, and to individuals' health. A rough logic model can help us see that ethical issues that could arise at different moments in the program. For example, there could be privacy or confidentiality issues about the way we plan to identify and contact the persons judged to be at risk, and depending on how we plan to convince them, the program could also end up infringing upon their autonomy. If we think that the whole program could reduce health inequalities, then not going forward with it could also raise ethical issues about equity and justice. Then we are asked to consider if burdens can be minimized and if there are alternative approaches. According to Cass, we are required, ethically, to choose the approach that poses fewer risks to other moral claims, such as liberty, privacy, opportunity, and justice, assuming benefits are not significantly reduced. So in a more complete analysis, we could assess whether it would be better to open more centers rather than busing people out of their neighborhoods. We could be creative, for instance, and ask if local partners from the communities, like restaurant and business owners, would be willing to open their door to welcome at-risk individuals during heat waves.
Moving on with the question, the 5th question would ask us if the program is implemented fairly. Now, to help with this question more concretely, we can ask, for example, if there's a fair distribution of benefits and burdens, if the program will increase or decrease inequalities, if the program is to be universal or if it's to be targeted to certain populations, if there's a risk of stigmatizing certain groups. In our case, just to touch briefly upon this, we would ask about those who would be at risk but happen to live in more affluent neighborhoods, for example. If there's a tendency for people at risk to not be aware or to identify themselves as at risk, will the people who live in other neighborhoods than the ones we've targeted as being where there's a higher population of people at risk, are we going to be contacting others in other neighborhoods where people are generally considered to be better off? That would be an important question. Will they be identified, contacted, and then encouraged to go to a cooling center? Also, we could ask if there's a risk of stigmatizing the neighborhoods that are targeted by the program as being neighborhoods at risk, or as being more problematic generally. And finally, among Cass's questions, we ask, how can the benefits and burdens of the program be fairly balanced? Now, she indicates that the greater the burden imposed by a program, the greater must be the expected public health benefit. And the more that burdens are imposed on one group to protect the health of another, the greater must be the expected benefit. And there's an issue of balancing these. It calls for democratic and equitable processes. So on the whole, we can ask if the programs or benefits are significant enough to make up for the disadvantages. And naturally, we should ask, how does one go about deciding this? Now, because the main burdens seem to be associated with the means by which people are identified, contacted, and convinced that they are at risk, we need to start by questioning these means and the burdens that they can impose. We can also ask, how was the decision made to transport people, and who was consulted in order to make such a decision? Normally, once we've responded to these 6 questions, if the framework has done its job in guiding us, the main ethical issues ought to have been illuminated in order to inform our deliberation about what to do. At the end of this, we'll have to make a decision about whether the program will continue, or be modified, or be replaced altogether with something else. Now, the use of an ethics framework during this deliberation can help to make the choices and the reasons for them more explicit. That can help to better justify those choices. Now, describing things in this way is somewhat idealized, of course, and as we can see, even from this quick example, the framework does not do the work for us. And a framework can be more or less useful for highlighting the ethical issues that are important in a given case. A framework is really a tool for helping reflection and deliberation, and it cannot replace them. And as is the case with all tools, some are better than others, and some are better adapted for some things and for some issues than are others. So let's check in again, and we'd like to ask, after this mini review of the case, are you still in favor, or are you now in favor of busing at-risk individuals to cooling stations in other neighborhoods? And let's see how it compares to what we found before. 80. There's quite a difference. Before it was about 15, 45, 40%. So apparently even just with that 10 minutes of having some time to reflect on it and chew on some of the issues, with the help of Cass, some of you have changed your minds, or just had more time to reflect on it. That's interesting. Thank you. Okay. Before we go on to discuss some of the main features of frameworks and some of the ways that they can vary, let's just take a moment to see if you have any questions or comments. Oh, I see a question from Peter. Yes, we have 2 or 3 examples of papers that are online that have been written up with people having used Cass's framework and then documenting their experiences. And what we've done, and there will be some links at the end, and we will point these out to you at the end, but we've produced a one-pager that summarizes Cass's framework, and it also has those references at the end. So for each of the frameworks we used today, we've done a one-pager in French and English, and we will put the links for those on our site. Please give an example of making assumptions explicit from this scenario. Okay, when we produced that logic model, based on our reading of some of the, just here and there on how people responded to heat waves, how municipalities develop heat response plans, we noticed that there was a great deal of talk about outreach strategies and how that would be done, and different ideas and different models for how to, 1, identify, and then 2, reach out to people who were judged to be at risk. And learning about some of the factors that cause people, or some of the reasons that people do not access cooling centers and so forth, it led us to realize that the assumptions we were making initially, that, okay, you make a bus, you ask people to ride on the bus if they need help, it left out some of the important thinking that needs to go into it. So when we develop a plan, we have to actually think about the different steps along the way. For example, we have to identify all the groups who could be at risk. We have to make sure that they've been contacted, and there are a whole host of issues there. Anyway, it's simply charting out the steps that would have to happen in order for the ultimate goal to be reached. I hope that helps. Just those steps along the way. Those are the assumptions. See a couple more people typing. We'll keep an eye on those. And maybe we shall move on.
Okay, so what is a framework and what can it do for us? So briefly speaking, frameworks are tools designed to guide public health practice, and as such, there is no need to be a specialist in ethics to use one. They can provide an entry point and a structure for deliberation by functioning like a lens for looking at and thereby seeing ethical issues. But since each framework provides a specific lens, they are not neutral. They frame the issue, even if they are usually flexible enough to tackle a variety of issues. One of the specificity of a framework is that it can help to to identify ethical issues, but the tensions between principles and values are dealt with through deliberation and not theory. A framework should therefore not be seen or treated as a formula or an algorithm that will automatically lead to a decision. This is a crucial point to remember. A framework would never replace taking a critical perspective to question the framing done by the framework and what is taken for granted in the case. We'll now present some of the differences between the frameworks found in public health ethics. We'll start by distinguishing the current situation in medical or clinical ethics from the one in public health ethics. In medical ethics, the framework that has been proposed by Beauchamp and Chadras about 35 years ago now dominates. Its four principles are respect for autonomy, beneficence, non-maleficence, and justice. It's a very well-known framework, even in public health. Sometimes it is referred to as principlism or as the four-principle approach. Amongst other reasons, its emphasis on individuals and not communities has led to the development of other frameworks for public health. Since about the year 2000, several have been proposed, but none of them have become as dominant in the field of public health as the four-principle approach is in the medical field. We have mentioned that frameworks are not neutral and that they frame the issues differently, depending, for instance, on the questions that they ask or the principles that they use. One way of analyzing this framing effect consists of situating them on a continuum that would go from a more liberal perspective that puts the emphasis on individual autonomy to a more communitarian perspective that would put the emphasis on communities and common goods. We can see on the slide where some of the frameworks will fall on this continuum, and the full reference to the frameworks are found at the end of the PowerPoint. If you're interested by this, we invite you to look at the document that we published with Marjorie McDonald. You can click now on the link below or see the full reference at the end of the PowerPoint. Frameworks also differ according to their scope. Some frameworks are meant to deal with any situation that can arise in public health. They are very general frameworks. Others have been proposed to deal with specific issues. So for example, there's a framework to evaluate interventions concerning obesity, and a few others to deal with pandemic issues. Another framework has been proposed specifically to assess when public health interventions that infringe upon autonomy are justified. Some frameworks are explicitly based on principles. Upsher's frameworks, for example, proposes to replace the four principles of medical ethics that we mentioned earlier by four other principles that are thought to be more adapted to public health practice. He proposes the harm principle, the least restrictive means, reciprocity, and transparency. Other frameworks are instead based on a series of questions like Cass's framework that we used at the beginning. Last but not least, frameworks differ on how explicit they are about methodological issues. Some authors claim that it is okay for frameworks to take for granted certain theoretical considerations and get right to business, while others claim that frameworks have to be very explicit about ethical justification and methodological approach. So, some frameworks are more explicit about their rationale than others. That is, they give a more complete explanation of why these principles or questions are relevant for the issue under consideration. Some frameworks are also more explicit about their justification than others, which by that we mean some are more explicit about the normative source of the ethical should. And finally, some frameworks are more explicit about the procedure that should be followed than others. That is, some offer more practical guidance about how to apply the principles and to balance them in case of conflicts, or how to deal with conflicting answers to different questions. Okay, so we realized that that was a lot of information in a very short amount of time. So we'll take a moment to breathe here and look at the chat box if you have any questions.
It's a very good question we have from a little earlier from Yosish. I hope I've pronounced that correctly. I found the sixth question in the framework quite interesting. Would you agree that defining the benefits and burdens of the program would require much community input? And if so, how would we use this framework to balance them? I think that that's the hardest part of the job, and frameworks will lead us to this point, and they may not always give us that much guidance as to what to do next. Probably we could at least agree that getting to the point where issues are highlighted is a good start, and many would respond by saying that what happens now is it has to be dealt with through deliberation. And we speak a little bit to this later on because we come to the same point when we work through the second framework, but the hard part is then deciding what to do, and there is no shall we say, airtight method for getting us through that, apart from discussion, deliberation, trying to highlight the issues and trying then to come to agreement or at least understand what the problems were with the decisions that we made. That is, it's a question of navigation. But the community input, absolutely. Any other questions along the way before we continue? But yeah, it's a great question.
So we have a question here about whether we can use the framework to examine the overarching role of a government in public health. I'm not sure I'm reading the question right, but if it is about looking at some frameworks have specific questions in them, and we'll see the next framework that we'll use has a question in it to look at not just the specific intervention, but whether it is the right intervention to do among any others that could be done in public health. I'm not sure if I read the question, but some frameworks are more designed for that than others.
And I think if we're talking about a single policy, we might have more success at applying a framework to consider some of the implications of that policy. If we're looking at a whole host of policies, I'm not sure that there are tools for doing that. Certainly a policy, we could take that on perhaps. Okay, let us move on with our second case. This one is about bike helmets, and this time we're going to depend on your participation in order to work our way through it. Now, as with the first case in the framework that we considered, our goal is not so much to resolve the issue, as we would need a lot more time and information to attempt that, but we will set it up, and we will see what it looks like to use a framework on a given situation to see what issues do arise. Now, let's imagine that your health authority is partnering with the provincial government to develop a mandatory helmet law for all cyclists. If the law passes, your office will be responsible for an information campaign, a rebate program for helmet purchases, and for ongoing research. 5 provinces already have this type of law, and 3 others have a law for minors only. Should your health authority support the mandatory use of helmets for cyclists? And we will ask you at first glance if you would support a helmet law requiring all cyclists to wear one. Yes is in the lead. Okay. ended up at about 75% yes. Okay, very interesting. Thank you. Now, to help us think about the ethical issues related to this law and the programs associated with it, we're going to use the framework developed by Baumel in 2007. We've adapted it slightly, and we're going to present it in 3 parts. And this one also is, we've produced a one-pager with a summary of this framework. In the first part of this, the framework asks us to consider 6 public health dimensions. In the second part, we're asked to consider 3 principles for medical ethics. And in the third part, we're asked to identify the ethical tensions and make some effort to reduce or resolve them. So the first dimension to consider is population-level utility. And we are asked, does the program generally advance the well-being of those in affected communities according to their conception of well-being? So an interesting aspect of this framework is that it doesn't ask us if the program improves the health or well-being of the population according to the conception of the public health practitioner, that is, where health is deemed as being the good. But rather, and that's a bit of a generalization, but it has us look at it differently, and according to the conception of what the community in general would judge as to whether it improves their well-being or not. So we'll open up the chat for your comments and your responses to this question, and we'll just see what people come up with, and we'll take a moment here for your input. Okay, we've got a couple of people typing. In the meantime, I'll ask everyone generally, do you think that this helmet law would advance the well-being according to their conception of well-being? And do you agree with this conception of well-being? We're trying to envision the sum total of people's estimations of their own well-being. Does that seem like the way to evaluate a program? I'll just wait another moment here. We've got people typing. We may have to move on and read those in a moment as we continue. Oh, we have a couple of opposition and perception of loss of liberty. Reduces the risk of harm or injury. Don't think you can say it will advance the well-being of the community. Okay. In what way would it not, Karen, in which way do you think it would not advance the well-being? How do you predict that the community would define its sense of well-being? Got a few people typing. We'll just take another second here to see. Oh, and I see another. Majority would likely support, but there may be some strong opposition and perception of loss of liberty. Indeed. Yep. Depends on the community. Depends how they define well-being. Agreed. Public health wants to reduce the impact of head injury. Yes. Okay, there's also the question of maybe that will reduce the amount of cycling. Yep. And we'll see in a moment. Some of the reports that we read preparing for this certainly recognize that as problematic. Very good point from Joanna there. If we evaluate a program based on its ability to advance the community's conception of well-being, does public health have a role in changing that conception? Very interesting point. And that's, in a sense, that's an application of stepping outside this framework and saying, well, okay, what are we doing here? That's That's some evidence of taking a critical view of this and saying, okay, obviously we're not going to have everyone agree with us, but there's obviously a role for public health here to share its conception of well-being and see if it can convince other people that that is a good way to go. Okay, we shall move along, but we will keep an eye on the chat as we go. The second dimension that we'll touch on here is evidence of effectiveness. I noticed that evidence is outside of the box, but let's imagine it's still inside the box on the screen. Is the program's effectiveness supported by the best available evidence? So we may have some expertise in the group, and we invite you to contribute, but we do not want to launch too far into an expert debate on the subject, and that's why we won't necessarily invite responses to this question. But to summarize it very, very briefly, we drew upon two documents in particular. We looked at a few, but we based our response here on a document from the ENSPQ and another from Public Health Ontario, who did reviews of the evidence on helmet laws. To summarize it very briefly, let's just say that according to those, helmet laws are associated with more people wearing helmets, but the more that the law applied to everyone in the population, the more that led to people wearing helmets. That if the law was combined with an education or an awareness program, it tended to lead to more helmet wearing, and that helmet use was associated with a reduction in head injuries, hospitalizations, and deaths. So that's just a very quick overview of some of the evidence. We'll move on to the next step. Justice and fairness, the next dimension. And we will ask, will the benefits and burdens be equitably distributed? So we'll open it up again and ask you what you think about this. Now, something to note, this is the framework's main point of entry for a discussion about equity, social justice. So this is a good occasion to think into that perspective. And just while people are typing, I'll respond to Richard. We didn't do a really extensive review of the literature on this issue, but even though some of the documents we consulted identified less people riding as a risk, they did not find enough evidence to say that that was borne out. In jurisdictions where they had helmet laws, they said, there doesn't seem to be a great decline in ridership. But again, that's a very complicated thing to measure. Like, what is the reason that there may be a general trend increasing and it could be affected by other factors? So the jury's still out on that. Okay, a very good point from guest 4. What about those who cannot afford a helmet? Rebates only help those who have the ability to pay up front. Yes. One thing that we saw in a few places where the laws were applied, there were incentive programs, and that was one reason we put it into our own scenario here. We have a subsidy. Now, that's not going to cover the whole cost, so that will affect some people more than others, clearly, and there's an issue of equity there. Okay, I think with that we'll move on. Maybe just a couple other points. There may be some more to consider. Who tends to ride without a helmet? Maybe there's some demographic issues there. Maybe not. But it's something that you could look into to find out. Maybe some groups will be affected more than others because they tend not to wear a helmet, or there's some reason for not wearing a helmet. Yep. And Greg, I see a point about very high cycle population on the roads, yet no helmet. And that's going to be something that we'll touch upon in a moment, but that's a good point for alternative approaches. So that leads us to the next dimension, which is that of accountability. And we can ask, will the justification behind the program be made public? And within this program, are the funds being used responsibly? With the description that we've offered so far, we haven't been able to give enough detail about this program to really respond to these questions. Now, in real life, developing a program and then start thinking about implementing it, obviously there will be a lot more detail, and you'll be able to take accountability more into consideration. But let's just say this. In an analysis of a real case, you really ought to be thinking about at least things like this. Were the people whom this would affect, or other stakeholders, were they consulted in the development of the program and in the considerations around it? Will the intervention logic be made explicit? As in, we think that wearing helmets will lead people, we think that subsidizing helmet purchases and having a law will encourage more people to wear helmets. That will lead to less people being injured, etc. Will that be made clear to the public? Will the choices underlying the program that favor some values over others be made public, along with the processes that led to those choices? So if we find some tensions between different values that we hold, for instance, we talked about loss of liberty against population level utility, or there'd be a group who would consider it to be completely against their values and what they want because they're being forced to. Will these choices that we make along the way be made public, along with the processes? And will the program be delivered in a way that uses the funds responsibly? These are the kinds of questions that would be related to this dimension. And we'll move on to consider cost and efficiency. So what are the costs of this program, and could this money be used more efficiently on another program? This time we're not asking if the program is well managed, as we saw within accountability, but rather if this is the right way to spend money to produce the effects that we want. We want to know if we should be spending on some other program that could perhaps have greater positive population level impacts. So just a couple of things to help us think about this one. The evidence seems to indicate that the subsidies for helmet purchases, just taking that part of the program into question, they're both effective and cost-effective for children and adults, but they're especially so for children. But we could also ask if it would not make more sense to focus on a different level altogether, where we talk about paying to improve cycling infrastructure in order to create safer spaces, instead of paying for helmets, awareness, and police surveillance. Now, there was just an earlier from, I think from Greg. Yeah, this speaks to what you said, Greg. Many countries have a very high cycle population on the roads, yet no helmet, and there are places where the infrastructure and the critical mass of cyclists is such that it's a whole different world in that sense. How wonderful if policies could publish the ethical reasoning behind their design. Yeah, we're completely in accord with that. And one step to doing that is actually making it explicit to ourselves. And we may come to points where we can't be certain that we're doing the right thing, but at least if we can talk about how we got there, we'll be doing something that many don't. So, last dimension that we'll consider in this first section from Maumeo is political feasibility. This is a somewhat original element in this framework, as not many other frameworks introduce it so explicitly within an ethical analysis. So this is our chance to talk about that a bit. We'll give you a moment to respond to the questions: is the program politically feasible, and what is the community's degree of acceptance of the program? Obviously the second one is a bit difficult, but we can imagine what we might find if we were to pitch such a thing. And that said, 5 provinces have this very law in place right now, so I think many of you can speak to this. Got a couple of people typing. In the meantime, we got many people typing now. Good. This may go back to Joanna's point. What is the role of public health in influencing a community's degree of acceptance of an intervention? Certainly. And part of developing and implementing a program, this time in partnership with the province, public health is going to be attempting to make the case, and the ways in which that's done can obviously speak to feasibility as well. Clearly, it's been problematized somewhere along the way. It's likely more politically feasible for Ontario now that we have the childhood bicycle laws for so long. Yeah, Ontario, Manitoba, and Alberta have the helmet law that applies only to under 18s. 5 provinces have comprehensive laws, and Quebec and Saskatchewan do not have a law at this point. So maybe once it's been introduced in that way, that could be a way in. At the same time, we have cell phone. You're not allowed to, in Quebec, for example, not allowed to drive a car while talking on a handheld cell phone, but you're allowed to use a hands-free. Maybe that'll become more palatable in the future to talk about banning hands-free, but for the moment, no. One additional question, this is sort of on the side, but we mentioned that this is an interesting addition to a framework to be talking about political feasibility. It'd be interesting to hear if anyone has an opinion about this as an element in an ethics framework, because we often hear about interventions that could be shown to reduce morbidity, mortality, but that do not get adopted, as some of you have already pointed out. Do you think that political feasibility or acceptability belongs as a factor for consideration in an ethics framework? Well, being championed doesn't necessarily make it ethical, but considering feasibility while developing a program may help one to take more considerations into mind while doing so.
It's interesting to see also what kind of ethical dimensions does it raise to say we're going to try to change the opinion of people and change the norms. It raises a whole other set of considerations that we haven't touched upon yet with those frameworks.
Okay, we are going to move along more as a matter of managing the clock and not keeping you over time. Then we'd rather stay and talk about these issues for a bit, but we'll move along. So, in the second part of the framework, we're asked to consider 3 key principles from medical ethics, just to see if they highlight any other important issues. So we'll consider individual autonomy, non-maleficence, which reads as not doing harm to others, and beneficence, which is doing good to others at an individual level, as opposed to doing good at the population level that we considered earlier with the population level utility question. So what do you think? Are there any other, very briefly, are there any other issues that arise by considering these 3 principles that were not highlighted earlier when we looked at those other dimensions? I think autonomy came up in the first, with respect to population level utility and understanding what people would consider to be a good to them, and the loss of autonomy in that case was seen to be an issue.
I think that Richard here has a good point about whether the political feasibility was already in place by looking at population level utility in a subjective manner. And I think there's some overlap, but it's not quite the same. The community could think as a whole that an intervention will improve their well-being, but it could still be not politically feasible to do it, for example, because of strong lobbies or other reasons. So the 2 questions are linked, but not necessarily the same.
Yes, and a very important distinction is just made about the ethically preferable option may not always be the politically favored option. Those are clearly 2 separate things, and they're not necessarily conjoined. Okay, we're going to step ahead to the last part, which is the most interesting and the most difficult. It asks us to identify any tensions between the different dimensions, as well as the principles that were considered. So according to the ground that we've covered so far, there's clearly some tension between, for example, autonomy and, for some people at least, population level utility. There's probably some tension within population level utility itself because of issues of individual autonomy and perhaps resistance to paternalism or being told what to do against your own will. Or perhaps we would find some tensions around the issue of what's deemed to be, no one mentioned this, but this is another possibility, what's deemed to be too much expense for the sake of a relatively small group of at-risk people. That would apply more in the case of the previous one, but you can well imagine cases where outreach is done to protect the health of marginalized citizens, and it's a very targeted it's a very targeted intervention. Some people will argue, well, that's not an appropriate use of funds because it reaches out to very few people. So that's just the kind of tension that we could have. Now, without going too far into identifying the tensions, let's just say that once in a particular case you've identified them or come up with as many as you can, you'll have to make an effort to balance them. And that's perhaps by deciding to favor one element over another. For example, favoring autonomy over utility or vice versa. But when you consider this, and by saying this was how you made your judgment, you will have actually added to the transparency as well as to the rigor of the process. And that would be akin to being able to say, here's why we decided this within a policy statement. In any case, for various reasons, we'll not take this case further, except to say that the more we can be clear about how we got here and what the issues are, the better equipped we are to make a decision. And that doesn't necessarily make it easier to make that decision, but it might make for a better decision all the same. We hope that we've been able to introduce a couple of frameworks and discuss how they can be put to use toward this end. So we'll quickly skip ahead to see if your opinion or your position has changed on this law. It was already fairly well defined. It was, I think, 7507 or so. 75% were yes, support the law. See if we come out the same. Less I do not know. 77-214. Okay. Very interesting. Thank you. So, fairly similar.
So, we're running out of time here, so to conclude, we'll simply restate that frameworks can help you see ethical issues, deliberate about options, make decisions, and justify them. That being said, it will be up to you to choose a framework that will work for you, your team, and your organization, and that will also work for the program, the policy, or the intervention that you want to evaluate. But that framework will still not do the work by itself, and I think that we cannot stress this enough. A framework is just a tool. It won't replace a good deliberation and a critical perspective, and we saw this in the chat box already. This is especially important when it comes to social justice, inequalities, and the norms that we often take for granted. It's hard to see how a framework could do this on its own. So we've now arrived at the end of our presentation, but before we sign off, we wanted first to thank you for your participation. And we'll go over a few slides rapidly to share some resources that we've put together and that will remain available both in the PowerPoint and in the recording of this webinar. So we have here a list of principles that often appear in frameworks in public health. If you're interested, we have some resources about them. Just send us an email. And we have here a collection of frameworks with links to them, and we've produced summary versions of some of them that we hope will be useful to you. We have them below the frameworks here. Some more frameworks here and here. And finally, some of our recent publications in ethics and some of the documents that we have in the works. The reference for today's presentation, and some information on evaluation and continuing education credits, but you'll receive an email about that today, I think, or tomorrow. So thank you again for participating.
And thanks so much for your comments. They were very helpful and very interesting.